Okay, good morning. This is the PT on Ice podcast coming live at you from Seattle, Washington. My name's Dr. Sarah Heron, and I am here again with some hip tips and tricks. So one of my favorite specialties to focus on in my clinical practice is hip impingement and labral tears, and we've been talking for the last couple of weeks about how to manage these patients conservatively. More and more research is coming out to show that the surgical outcomes aren't actually where we would want them to be to make surgery the number one choice. And as physical therapists, of course, we feel like we can positively affect these patients in ways outside of surgery. So I want to continue to talk about this because my methodology has been working quite well, and the general premise has been to calm down the inflamed structures, to decrease the fear in the patient's mind, and then to uptrain the correct motor pattern. So that's what we do in physical therapy. Okay. Last week we went through TFL down training, so getting the patient to understand that this pattern of over hip flexion doesn't need to exist all day long. And what it can do is it can shove that femur even more forward in that acetabulum and cause the pinching that they're feeling. We then talked about psoas uptraining and how once they're ready to start using the right hip flexors, they can start eccentrically lowering using that psoas. We talked about how a little bit of an effort into internal rotation, or neutral really is what they're going to be aiming for since they like external rotation, is going to help to center that femur and get them to be able to drop down, maintaining that centration of the joint. And ultimately, we hope that they get a little less of that clunking and clicking. Then we talked about rock backs and how that can help to center the femur back into the socket. And finally we talked about bridging and how to achieve bridging without, again, using that hip flexor to do the movement. So a lot of folks will try to round up and use hip flexion to achieve a flat back position, and then they feel like they're getting it in their glutes, but they're just really reinforcing that patterning. So this week, I want to talk about how to progress from those basics, right? And I'm not somebody who loves to put people on the ground and get them doing little minuscule exercises. Clamshells are like my least favorite thing in the world. However, sometimes we need to get people to down train something that's overactive. And then if they've been doing that for a long time, it takes quite a bit of time to uptrain the things that need to be turned on. So before we get started in standing, I want to talk about a term that I use a lot called, and I say this to my athletes in the CrossFit gym, I just say, close your bowls. So close your bowls. And what I mean by that is that if the pelvis is a bowl, a right side up bowl, then your rib cage is an upside down bowl. Okay, and we actually want those two structures to match. By matching, we create this like canister, right? And from that, then if the spine is stable and your bowls are closed, you can get true hinging or movement from your hip joint instead of arching or extension or flexion of the spine. Okay, now a hip impingement patient tends to close their bowls by tucking their butt under. So what that's going to look like, if I'm standing, is that instead, if I'm kind of flared like this, instead of bringing their rib cage in, they will tuck their booty, right? And so what they're doing is they're really just kind of shutting off their glutes, any potential for their glutes to do anything, and they're just shoving that femur forward. They feel like they're stacked, but they're just, as we call, hanging on their ligaments. Right? So instead, I want them to feel this idea of like their abdominals doing the work. I jokingly call this their fake abs because they're using that technique to create a sense of stability, but truly they're just using their hip flexors. Okay, so I like to use that terminology. It helps a lot with my athletes when they're overextending, right? I can just say, close your ribs down, close your bowls. But what I really mean is close your top bowl. Okay, it's just an easy analogy for them to understand. So, A good way to teach this, if your patient isn't quite understanding, there's lots of ways to do it, and there's lots of ways to do it supine that we can get into at another time, but I'm going to teach you with a dowel, because now we want our patients standing. They've been on the table, we've got them calmed down, and now we want to get them moving through their real life. Okay, so with the dowel, I'm going to take my dowel and I'm going to place it tailbone, bra line, or kind of rib cage area, and head. Now, if I can't bring my rib cage in, and I'm sort of here, to create contact with my ribs, I could tuck my butt under, right? So we want to make sure that they're not doing that, that they're instead bringing their rib cage in. Can you see that? I tried to wear a shirt that you guys could see this. So again, my tailbone is connected, my head is connected, and I need to bring my rib cage back using my abs. Oops, let's see. Like that. Okay, not like this. Okay, once they understand that concept, then we can move on. If they can't understand it, we've got to get them supine. And ways to kind of help with that. So we could do lying supine and put something under their rib cage, like under that bra line area. You are trying to pull it out from under them, and they are trying to push their ribs down without tucking their butt under. That's a good one. You can use a foam roller, so they're laying on that foam roller lengthwise, tailbone to head on the roller, and that can help them with some proprioception of where is that floor, where is that foam roller. Okay, so let me know if you have questions on that stuff, but I do think the dowel works pretty well. And in my clinic, you can see I have 2 mirrors. I have them 90 degrees to each other, so people can kind of see in that corner angle, you know, what am I doing from the sagittal plane? What am I doing from the frontal plane? So if you have access to something like that, that can be really helpful. But regardless, they probably do need a mirror. So even in my gym space, we have a tall, like, closet mirror. And a lot of my patients are athletes at the gym that I coach at, and I just have them carry it out into the gym while they're doing their PT exercises, because oftentimes they're so patterned to work a certain way that they really need to visualize it. So in CrossFit, we don't use mirrors, and that's good, and we need to learn how to feel what we're feeling, what we're doing, but I think it's okay in rehab to be able to watch yourself. Okay, so once we figure out how to get into that perfect position, that ribs down position where we're not engaging the hip flexors, then we can move on. So the first thing that we teach here is the hip hinge. So we're going to, again, achieve our dowel position, 3 points of contact, and I'm using a ribs in position, not a butt tuck. Okay, then I'm going to fold at the hip crease. I'm going to fold, sending my booty back. My shins are staying relatively vertical. Let's see if I can reposition myself so you can see that. Look in the mirror right back here. If you're on Facebook. Okay, if you're on Instagram, you can see my shins. You can see that my butt is going back, my shins are staying vertical. Often what will happen is the patient will do this. They lead with their knees are coming forward. Okay, their hip is in about the same angle, but they're not initiating with this movement or with that structure. So we need them to tip. Okay, if they do not feel hamstring stretching, even your dancers with really long hamstrings should feel this if they are truly hinging at the hip. If they don't, it's likely that they're flared here, right? And they're getting extension to do it. Okay, and we all know that they can't be rounding. Okay, so the common faults are going to be arching, and these are subtle, right? I'm exaggerating, but it'll be subtle. The next one would be bending in through the knees. I don't often see this, but you could see that. And then for me, because I treat a lot of dancers, all the dancers do this, and they go over their legs. Okay, that's what we're taught in dance. So instead of going back, they go over. Okay, and in most of these cases, even if they have the perfect positioning, they often are gripping with their hip flexor. So they're pulling themselves down into that position. We want to think that a hinge is really eccentrically loading that posterior side of the body. Excuse me. And so rather than pulling them into the position and creating that anterior shear of the femur and kind of scrunching up the joint and making it feel stiff again and stuck and tight, right? They need to learn to fold and softly sort of, I even say like chop at the hip, right? So that this is doing the work. Okay, so that can take time, right? That can take a long time for them to figure that out. But once they do, then it's important that we start to load it. Now, before we load it, we have to figure out how to get this off of their spine, okay? So they've been used to like, okay, my ribs have to touch this. I know that. I don't tuck my butt and my ribs need to touch. But what if we bring the dowel here now as if it's a barbell, okay? Can they reproduce that same sensation, or do they start to hinge a little bit? And they're like, I don't feel it, okay? So they need to figure that out. Ribs in, load here. Okay, so I will always bring them to like a blank bar or a dowel even if you've got these things. This is from Fred Meyer for $4. So you can get dowels pretty easily. And I have a little shorty in the clinic because I don't want them to whack in the ceiling, but in the gym, like a PVC pipe, whatever you have. Okay, so then once they figure that out, we know that we can start to load them. So this can then turn into a blank barbell. I really like kettlebell deadlifts for this movement. So I'm going to show you that. Okay, so with my kettlebell movement, I'm going to start from the top down, but of course, you'll in that case have to hand them the kettlebell. So we also need to learn how to pick it up from the ground, but we're not going to go into that today because I want to focus on the hip hinge. So I'm going to, again, ribs down, hinge back. Okay, my shins are staying vertical. Let's see here. My small little space and cameras. Okay, now this kettlebell needs to stay really close to my body. I'm aiming it between my feet. Okay, if it's coming out here, A, I'm getting a ton of pressure on my spine, and B, I'm not hinging. Okay, so it's touching me. It's touching my thighs, and I'm sending my booty back. Feeling that tension pushing through my feet to stand back up and squeeze my butt. At the top, make sure that they're not jamming forward. Okay, so that's a nice one. And again, if you're using a blank bar and you haven't taught them how to take it from the floor, you can set the J hooks on your rig low so that they just have to pull that bar off of the rack at like a launch position. Okay, so I really like loading this position, and this is something that like they need to do lots of reps of, right? So we've been talking a lot about remoms. This is a great way to add that in. So you're doing like every minute on the minute, you're doing their rehab exercises. So have them do some weighted, correct hinging hip hinges. Okay, then we need to get into single leg, right? So single leg is ultra important for runners. Almost all of my runners, when I test them, when I say like, oops, do a single leg hip hinge for me, they're like all over the place, right? And if you think about running, like shoot, every time you land, your knee's gonna dive in. Well, that's why you have hip pain, right? Or that's why you have knee pain. So we need to dial that in. So I go through the same process. Can you hip hinge correctly? Can you do it on 2 feet? All right, now we're gonna do it on 1 foot. So I know that we all teach this stuff. I just want you to be picky about how they actually hinge. Are they gripping, or are they truly loading their posterior chain, or are they using their back? And secondly, I want to, of course, make sure that they're in all of that alignment. But you need to talk to them and find out, you know, where do you feel this? Do you feel this in your butt? Do you feel it in your quad? Do you not feel it at all? If they look good, which many of them will, but they don't feel it, then they are not accessing those muscles. Okay? Okay, so I'm real nitpicky with this. I want a level pelvis. I want the dowel in the opposite hand as the foot I'm standing on. And then I'm going to fold. And I'm going into that same loaded position here. And back up. Folding. And back up. From the front, I should be sure that their knee is not diving in, that it's pushing into neutral, okay, and that they're feeling that there. A good cheat for those folks when they've had PT and they know not to let their knee dive in is they will let their hip do this. Same thing. It's basically this, okay? So once they get that mastered, again, that can take a while because they may have that habit of just folding over like the dancers or squatting through the knee, okay? Or arching their back or whatever they're doing. Then you can load it once they figure it out. But again, once you load it, I often will see someone will have a weight in their hand and they care so much about touching the ground that they're all over the mat. So if I'm gonna load it, personally, I put the weight in the opposite hand that I'm standing on because that weight's gonna try to do this to me. So I'm up like so, and then I am only going until I feel that stretch back here. Okay, so from the side. Okay, I'm feeling that loaded. It doesn't matter if I go all the way to the floor because now I'm not using my hip the way that I want them to use their hip. Okay, the last thing that I want to hit on, because I know I'm using up a lot of time here, is step ups. So same premise here. We want to think about folding at the hip joint, not gripping it, and using the posterior chain. So I'm going to change my angle a little bit. Okay. So I have a stool here. Let's see if you can see that. This is about 10 inches off the ground. Okay. A stair is 7 typically. So you can practice on a stair just fine. I'm going to have them plant their foot on the step and immediately they're going to try to do this. Okay. And that's what we look like when we go up and down stairs. That's fine. But somebody who has hip impingement, they don't know how to use this. The rest of us, we go up and down stairs, even if we're in this position, we are still using our butt to extend, right? We're using our glutes to extend that leg. Someone with hip impingement is truly only using this. So we need to put them at a mechanical advantage, okay? We're going to chop at the hip. Well, first we're gonna go bowls closed, checklist here. Rib cage, hinge, vertical shin, support. Okay, now of course I'm managing, does my knee dive in, but from this angle, I want you to think about pushing, you can even cue them, push through your heel, push so that you feel this. Okay, and it may take them a couple times because they're gonna wanna do this, or they're gonna launch from their bottom leg, okay? So they need to hinge, this is soft, right? And press through that foot. From the front, if they're not soft in their hip flexor, they'll kind of be like this. So you'll see them kind of hiked up and you need to say, stop, soft. Okay, that's not doing the work, right? You can put your hand here so that they shift back. This needs to be soft. Press through that heel and stand. Okay, so I hope that gives you guys a couple ideas of how to take these patients from turning down their TFL on the table, up training their psoas, centering that femur, and then these exercises are designed to anchor that femur in there, right? So if we can be stronger in the glutes, then we have a better potential for that femur to stay back in there. Okay, there's way more that we can do. Let me know if you have questions. Get after it. It's Thursday, almost the end of the week. I'm sorry I took up so much time, but I think that was a good handful of things to try. So I'll look forward to next time and have a great day. Thanks, guys.